In this session, we're going to review the high-yield material commonly tested on the USMLE regarding the GI system. The topics that we're going to cover here are mesenteric ischemia, hemorrhoids, Crohn's disease, malabsorption, viral hepatitis, and primary biliary cirrhosis. I have no disclosures. We'll start with mesenteric ischemia. The problem over here is that the bowel is not getting enough blood, and there are a few reasons for it. One can be blood clots. If there's some clot in these vessels, the blood's not going to get here and the tissue down here is going to become necrotic. It's going to die off. One reason for clots can be these septic emboli. For example, someone who has an infective endocarditis, there's a heart infection on this valve. Little pieces can pass through the ventricle, down the aorta, and when it goes through the mesenteric arteries, it gets stuck, and you end up with mesenteric ischemia. Typically, this occurs in older people, and they suddenly have an urge to defecate. And one thing very commonly associated with this is pain out of proportion on the examination, and there's nothing worse than stepping on a Lego. Hemorrhoids are the next topic. There's internal and external. These ones, the internal ones, are above the dentate line, this line here. These ones have painless bleeding. These ones are not painless. These ones can become thrombosed. And they may present to you a young patient, no real risk factors, with what you think is a hemorrhoid. You're not entirely sure. What's the next best step? The answer is going to be an anoscopy. And the first line treatment for hemorrhoids is going to be lifestyle modification. Crohn's disease, in contrast to ulcerative colitis, which is just the mucosas involved, here Crohn's disease attacks all the layers. It's a transmural disease. And the questions may not mention all the typical buzzwords of skip lesions and cobblestoning. They may just describe someone who is losing weight as a canker sore and an elevated ESR. And what they're referring to is Crohn's disease. ESR is the distance that the blood settles within an hour. An elevated ESR typically reveals that there's some kind of systemic infection going on. That is Crohn's disease. Next is malabsorption. Here in a healthy person, the villi on the intestines, this is the inside of the intestines, these little projections absorb the nutrients and the food, and it goes down here into the blood. When you have certain disorders and you lose these villi, you're not able to absorb nutrients. This is seen with celiac disease up here. This is the past positive in the lamina propria. This is a disease called Whipple's disease. You lose your ability to absorb. And one thing examiners like you to be aware of is that when you lose your villi, you also can't absorb iron. So you get an iron deficiency anemia. A test that you can do to see if someone is absorbing food or not is called the D-xylose test. And essentially, D-xylose is something that is only absorbed in the villi. So you give them some of it to eat, and then you check later if it's in the urine or if it's in the blood. And the only way it'll get to the urine and the blood is if the body absorbed it. So if you give it to them to eat and the villi absorb it, it'll be in the blood and it'll be in the urine. But if they have villus atrophy, they won't be able to absorb it and it won't be in the urine or their blood. Viral hepatitis, we're going to focus here just on Hep B and the markers for it. When the virus first comes in, the first thing I see here is this nice blue color. The first thing that you'll be able to see is the surface. The surface of the virus is really what stands out. The immune system, though, doesn't really care about these shiny things. When it attacks the virus, it goes straight to the middle, right here to the core of the virus. And the immune system uses these guys. These are antibodies. First the IgM antibodies, and later they become a little less chunky and they a little more specific, and they become these IgGs as time goes on. And so the first thing you see again is the surface. Then the body attacks the core. The body switches from these IgMs to these IgGs, and then finally, once the core is dealt with, these little particles, the body will deal with these little particles, the surface guys. And so if you were to look at the markers, you would see the Hep B surface antigen. Here you'd see the anti-core antibody become an IgM, later an IgG, and then you'd see the anti-surface antibody. What are these guys down here? This is the envelope. The envelope, HBE, correlates with infectivity, comes during this window, and it disappears during this time as well. So the HBE is something that you'll see while you're seeing the surface. You'll see this a little bit, and then it goes away, and the body only takes care of the envelope, the HBE, after it already attacked the core. So again, you have the surface, the body attacks the core, switches from the IgMs to the IgGs, then the body attacks the surface. While the surface was originally here, there was some HBE, this envelope was here. The body didn't care. First it attacked the core, and then it took care of this. And then finally, this last picture here is the vaccine, and hopefully you can see it's missing these little pieces in the middle because the vaccine only contains the surface of the virus. If you give it, the body's just going to attack the surface. And so if a question asks, how do you know if someone was vaccinated? Well, they should have an anti-surface antibody. They should have these, they should be able to target the surface because you gave it to them. However, if someone has a previous infection that now cleared, besides for having these anti-surface antibodies, they'll also have these IgGs now against the core. Primary biliary cirrhosis is the last topic we'll talk about. This is a middle-aged woman with insidious onset. She may come in with itching, and if you take a look at the bile duct, it's not dilated. And the reason the bile duct isn't dilated is because this is a biliary cirrhosis. The problem here is inside the liver. And so the bile duct down here is not going to be dilated. A couple of things to be aware of. First, this is autoimmune, meaning the body is doing this to itself. And anytime there's an autoimmune disease, there's a likelihood that that patient has another autoimmune process going on. These patients also tend to get osteoporosis, and they have a very high lipid count. I wish you the best of luck. If you found this video helpful, please let me know. If you have any questions, feel free to reach out, and I'll be happy to answer them as soon as I can.